Hi, my name is Kevin Sinnott. I'm a volunteer for Macmillan Cancer Support based in Craigavon Area Hospital and the Information Centre. My role is to open the centre and stock the cells with information from Macmillan on a range of cancer issues, from finance through to health and healthy living. Our role is really to meet members of the public and anybody else who is suffering from cancer and provide them with information, or to send and post them to people who are more expert on issues such as finance. Person-centred care for me is actually treating everybody very much as an individual. It's just like I would like to be treated. Quite often you arrive in a place and you are, as people say, a number, and you're in a queue and you go through it and you're treated and you're moved on. But for me, it's just talking to someone. Quite often people come into our centre and whilst they're looking for information, they actually just want to talk to someone who's not a medical person or a member of their family, so they can just offload and have you as a soundboard, and you can give empathy or sympathy, whichever you like to call it, and just treat them as an individual and listen to what their problem is for that day. It may only seem like a trivial thing to you, but to them it's their whole world. So for me, that's the key for it. Treating them as a person, treating them as an individual.
Hello, my name is Jane Hill. I work as a staff nurse in the cancer services within the Mandeville unit in Craigavon Area Hospital. I have undertaken a new role, which is clinical lead nurse for the ZipCam project, which is co-producing and implementing person-centredness in cancer nursing. We as nurses provide safe, effective, high-quality care to each individual, although measuring the quality of nursing care is not easy. Therefore, within this new role, it will help us measure what matters by co-production. Co-production is not just a word or a concept. It is a meeting of minds coming together to find shared solutions. In practice, co-production involves the people who use the services being consulted, included, and working together from the start. When co-production works best, the people who use the service and carers are valued by the organisations as equal partners. They can share their power and have influence over decisions made. It refocuses on the fundamentals of nursing and a desire to improve the patient experience.
My name is Barbara Bailey. I was diagnosed with third stage breast cancer in 2008. While this was a tremendous shock, I had very good support from the consultant and the nurses who were looking after me. While I did feel as though I was on a conveyor belt at the very beginning, I did feel that I was cared for because the nurses and the doctors did listen to me. My after-treatment care has been excellent. I have had to do self-drainage. I've been left with a lifelong problem in which I have to drain at least 3 times a day to keep myself from having infections. My consultant has worked tirelessly with me to get this right, to get this drainage right. We've had a couple of blips, but I feel now that I am on the right road in doing my self-management in the drainage of my breast. My consultant has now said that I do not need to see her for a year. She is so pleased with my progress. The physios have been excellent, very caring and very helpful. But my mindset is, from my whole journey, that I was valued, I was cared for, and I was listened to. And I have been kept out of hospital now since 2016, and that is very important to me. Thank you.
Hello, my name is Maria Tynan. I work as a Macmillan Specialist Dietitian in the Southern Trust.
Hello, my name is Edale Cardy and I'm an Oncology Specialist Dietitian in Craigavon Hospital.
Many people have eating difficulties during and after treatment for cancer, and cancer care can vary from a few days to months or years.
And we know that it is vitally important to screen and identify people who are having difficulties and ensure that staff can give them the best, up-to-date nutritional advice. So we have developed this guidance document with the help of other staff across the Southern Trust and patients from the cancer user group.
It contains a nutritional screening tool, information and practical advice on common difficulties such as weight loss, nausea, sore mouth, diarrhea, and how to support people in carers who are struggling with loss of appetite.
Thus far, we have carried out training for staff who work closely with this group of people, and more training is planned.
If you want more information, go to the Southern Trust intranet and look under the electronic directory of services, and if you go to Southern Guidelines and search for nutrition.
If you are a patient or a carer and you have queries or concerns, contact your healthcare professional for advice who may suggest referral on to a dietitian. Thank you.
Hi, my name is Caroline Davies. I'm the Macmillan Health and Wellbeing Support Worker. I'm based in the Macmillan Information Centre in Craigavon Area Hospital, and I'm just here to talk about what person-centred care means to me. Basically, it means that everybody should be treated as an individual, and we need to remember that even though someone has the same sort of symptoms as another person, that their needs aren't necessarily going to be the same. And it's basically tailoring our care and our support towards them and listening effectively to what they want, and what their needs are, and what we can do to help that particular person, and not just assume that we know best.
Here in the Mandeville unit, we do our utmost to provide person-centred care by offering high quality, coordinated care and support throughout treatment. We involve the patient at each step of their journey. For me, it is about looking beyond a disease or a diagnosis and to find out what really matters to that individual and meeting their needs. We rely heavily on service user feedback and have patients involved in our steering groups in any improvement project that we have embarked on.
It comes as no surprise that cancer patients can worry about spread within their body, but also cancer spreads from day one to all aspects of their lives, especially throughout their family circle. If we want to deliver on person-centred care, we must involve the family, however that is defined by the patient. Good communication is vital. George Bernard Shaw said the biggest problem with communication is the illusion that it has taken place. So honest communication about the physical, psychological, social and spiritual issues helps us formulate a plan in partnership with the patient and their family, which is more likely to be successful and satisfy all parties. This will only happen, however, if it is realistic and deliverable with dignity and respect. With person-centred care, patients do better because life is 10% what happens to us and 90% of how we react to it.
Hello, my name is Ethna McLinden. I'm now 52 years old and I worked as a primary school teacher. In January 2014, I was diagnosed with triple-negative breast cancer. And when you hear the words you have cancer, your head just goes into a spin and your life becomes a roller coaster. The evening I was diagnosed, I attended the triple-negative assessment clinic just for peace of mind, given that a recent mammogram had read satisfactory and nothing had prepared me for what was to follow. But the manner in which the consultant conveyed this horrific news to me, however, instilled a great sense of confidence and positivity within me, and this gave me the strength to face the dark road that lay ahead. From the initial consultation through to surgery, follow-up appointments, I was blessed with a continuity of care from a consultant and a clinical nurse specialist whom I felt they took the time to get to know me as a person. They listened attentively and they took on board my anxieties and concerns, and when planning an appropriate treatment path for me. I had the greatest confidence in them both, and I trusted them to do their job that they knew best. Looking back on this experience, I firmly believe that I received the highest possible standard of person-centred care available, and no words can express the positive impact that these two individuals have had during the most terrifying experience of my life. Anyone who has had chemo will know that there just aren't the words to describe it. It's only the dedication and the commitment of the staff within the Macmillan unit that carry you through it. Having had a double mastectomy, immediate reconstructive surgery, 6 cycles of chemo, nipple reconstruction and tattooing, and 2 surgeries on my left lung, I have spent many's a night on a hospital ward. Whilst the majority of these days were comfortable, I feel that there are, if you're really serious about implementing personal-centred care, much needs to be done to bring our nurses back onto the wards, to allow them to interact and to care for their patients, instead of the huddles that, to the visiting eye, they just seem to congregate around the nurse's station. When sickness comes, and you are just so, with sickness comes an immense vulnerability. Post-operation, the initial days, you are 100% reliant on the care of the nurses and the support staff.